welcome to week 3 of the CLS revision. I'm Casey. So this week in week 3 we went over soft tissue injuries and hemorrhage control. Soft tissue injuries go into the two categories: open wounds and closed wounds. Closed wounds being something you can't see from the outside unless it's like the bruising, so something that's happening on the inside, hence the closed wounds. Open wounds are something you can see where the blood's actually coming out. That goes into multiple categories like lacerations, abrasions, punctures, incisions. We more looked at the lacerations is when someone falls and it's all jagged edges. Incisions being when it's like a sharp object hitting you and it's just like a clean cut. We also went over injection injuries when something hits you hard, like a hydraulic fuel pressure line, something like that. Also impaled and how to sort of wrap that around with a bandage and those sorts of things went over as well. We went over a physiological response to an actual injury, being the vasoconstriction spasms, and then it goes into the platelet plug to actually stop the bleeding, and then it actually goes into coagulation, where the bleeding as well stops from the inside as well as the outside. Then we went on to the actual wound healing stages, which we did in BMS 291 as well, but there being the coagulation, inflammation, and the granulation, the formation of the actual scar tissues. That was mainly it that we went over for soft tissue injuries. Not that we don't do stitching, so we didn't go over anything like that. We just went over how to sort of apply pressures and all those sorts of things. Then we went into haemorrhage control, which is to do with open wounds. We went on to how to maintain haemorrhage control and how to use tourniquets. We went over putting direct pressure on that to stop the bleeding coming out, obviously, to then hopefully stop the bleeding. You've got to elevate that above the heart to stop the actual pulsation of the blood. And then, like I said, we went over all the different sorts of tourniquets. We looked at some videos from the army, which we don't really use most of their things, but we went over all their different tourniquets and how to use them in sort of pressure situations. And then we sort of touched on drugs, which isn't really in this topic, but we did touch on some sort of drugs that would stop the hemorrhaging. And that was week 2. Thank you.